In the 1983 movie Never Say Never Again, the bad guy goes under the knife to match his retina to the US president's so that he can fool a retinal scanner and gain control of nuclear weapons. And of course, James Bond manages to save the day while also being exceedingly dashing. We have retinal scanners in real life too, though it turns out as spy gadgets, they kind of suck. Instead, this James Bond tech has found its way into your eye doctor's office, where it has the potential to improve your overall health for years to come. Here's how. The retina is the very back of the eye, and it's home to your rods and cones, the receptors that turn light into electrical signals for the brain to process. Tons of blood vessels crisscross it, providing oxygen and energy for it to do its job. Because structures in the eye need to be transparent for light to pass through, doctors can see the retina using completely non-invasive methods with the right tools. If you've ever had an optometrist put drops into your eyes and give you those ridiculous sunglasses when you leave, it's because they were trying to take a gander at your retina. Being able to see those structures gives them a sense for how healthy the eye is. But the tech of Bond movies might spell the end of those annoying drops forever. Way back in 1926, the first commercially available retinal camera was able to image about 20 degrees of the retina, which is helpful, but a pretty small slice. Since the structure of the retina is unique to the individual, spy movie writers, and real spies, pictured using this technology as a sophisticated identification device. So they do work, but it turns out they suck to actually use. Among other things, having a thing you stick your eye close to is kind of asking for pink eye. Instead, devices similar to these are seeing way more use in healthcare and are working their way into optometrist offices, and they're improving fast. Anything that allows for more than 100 degrees of visibility is considered ultra-widefield retinal imaging. The most state-of-the-art instrument available at the time we're writing this lets doctors see 200 degrees of the retina, or 82% of it in a single image. Being able to see more of the outer part of the retina, not just the center, gives us even more information about our health. And these fancy cameras have another advantage. Cameras take pictures. Instead of just allowing doctors to see what your retina looks like right now, they can save previous images in your file and compare changes over time. So you can eye another day. Now, better retinal imaging is obviously good news for diagnosing eye diseases. Some, like glaucoma, don't have early symptoms. In fact, half of people with glaucoma don't realize they have it. And treatment for glaucoma can't restore vision, but it can keep vision loss from getting any worse. So early detection is essential. Studies are indicating that ultra-widefield imaging can show subtle changes in the retina that are indicative of early glaucoma, letting doctors catch it earlier than they could before. But the diagnosing that ultra-widefield retinal imaging systems can do isn't for your eyes only. It can give us information about diseases in other body systems too. For example, diabetes can cause changes in the retina known as diabetic retinopathy. High blood sugar can damage blood vessels all over the body, causing them to leak or bleed, and the retina has plenty of blood vessels. One risk factor for the progression of diabetic retinopathy is having more lesions toward the edges of the retina, which ultra-widefield imaging allows us to see. Which means that about 20% of the time, using ultra-widefield imaging ends up diagnosing diabetic retinopathy as more severe than traditional screening methods. But more than that, between 10 and 20% of adult diabetes cases are undiagnosed. So it's possible that optometrists may be able to use retinal imaging to catch diabetic retinopathy in patients who haven't been diagnosed with diabetes in the first place, making the eye doctor a pretty unexpected way to identify those people and make sure they get care. The retina can also tell us about heart health. The tiny blood vessels in the retina are related to the blood vessels in the rest of the body, which means they can give us a view to a kill cardiovascular disease. Changes in retinal blood vessels are associated with risk of cardiovascular disease, especially stroke. In this case, imaging the retina provides a few new opportunities. For one thing, it can provide more fine-grained detail about a patient's level of risk, and that helps doctors plan accordingly. For another, the photography component means that images can more easily be compared over time to see if there are changes. And maybe most beneficially, some people may be more likely to go to a yearly optometrist visit than a general checkup, So if this test was included in a standard eye exam, more people would be getting screened for cardiovascular disease. Our eyes can tell us about our brains too. The eye is the only part of the central nervous system that you can see with simple methods. So this kind of imaging shows a lot of promise for studying and diagnosing central nervous system disorders, like Alzheimer's disease. Just like Alzheimer's causes a loss of neurons in the brain, it can also cause a loss of the neurons that connect the retina to the brain. Retinal imaging can determine the thickness of the retina, specifically the layer that holds all those neurons and their projections, which can tell us whether those neurons are dying off. The thing is, we're currently not great at diagnosing Alzheimer's while a patient is still alive. One estimate is that 50 to 80% of Alzheimer's cases can go unrecognized. So just like with cardiovascular disease, ultra-widefield retinal imaging could be easier, cheaper, and more available than any of our other diagnostic tests, allowing more people to be diagnosed and treated sooner. So while ultra-widefield retinal imaging was kind of a flop for unlocking your apartment or boarding a plane, it shows a lot of promise for monitoring not just eye health, but whole body health. It allows us to establish baselines and monitor patients so small changes can be caught early. And lots of people wear glasses, so lots of people go to the eye doctor on a regular basis. It's actually hard to overstate how huge that is. Like, doctors can't help people they don't see, so having your eye doctor being able to screen for this stuff should amount to getting this stuff found and treated. We're constantly learning more about how the eye is involved in health, and as these devices appear in more optometrists' offices, hopefully we're only at the beginning of retinal imaging helping people live and let eye. Sorry. Thanks to all our patrons for helping make this video possible, but especially this month's President of Science, McLaren Stanley, who is officially cooler than at least half of the Bonds. Your support makes these videos available to everyone, so thanks.